Today is long overdue. And just as a reminder for the public tuning in, we are here today on behalf of the over 15,000 vulnerable seniors in nursing homes who died because of Governor Cuomo's fatal executive order on March 25th, damning them to this horrible fate, including constituents in my district and every congressional district in New York State. I also want to recognize the families and advocates who have been working tirelessly on behalf of their loved ones amidst this grief, who have been smeared, attacked, and denigrated by Governor Cuomo and his most senior aides. Let me begin first. After months of inquiry and investigation, we now know irrefutably what New Yorkers have known for years, that Governor Cuomo himself and his most senior aides ordered, directed, and executed this deadly executive order counter to CMS and CDC guidance. Our investigation also reveals, a bipartisan investigation, that the disgraced former governor and his top aides were caught covering up their culpability and guilt to selfishly save their shredded reputations. I want to start with the March 25th directive. Isn't it correct, former governor, that Dr. Zucker served as your commissioner of health during the COVID crisis?
Yes.
And you have stated and shared that you have great respect for Dr. Zucker's work and professionalism. You have said that in the past. Is that correct?
I don't know if I've used those words, but I'll take your word for it.
Do you have respect for Dr. Zucker and his professionalism? Yes. Are you aware that Dr. Zucker testified that the March directive was prompted by a direct request to you, former Governor Cuomo, from the Greater New York Hospital Association? Are you aware of that fact?
I'm not aware of his testimony, no.
Well, that was what he testified to this committee. Dr. Zucker also went on to say, quote, Greater New York Hospital Association called the governor and the team. We were all there in a conversation, end quote. I also want to add, are you aware that another staffer at the Department of Health testified that the March 25th order did receive sign-off from the executive chamber? Are you aware of that fact?
No, I'm aware of the testimony to the exact opposite that you received.
That is incorrect. He said, yes, absolutely.
That's not the testimony that I have before me.
The testimony I have before me, when he was asked whether the March 25th order was signed off by the executive chamber, the answer was yes, absolutely. And on top of that, Dr. Zucker testified that, quote, everything goes through the governor's office. And by the way, Governor, you and I both know that under your terrible leadership in New York, everything does go through the governor's office. My follow-up is it wasn't just the directive itself, Governor, it was the cover-up. Yeah. This investigation found that you, former governor, and your most senior aides made a deliberate decision to exclude certain COVID-19 related nursing home deaths to hide and undercount the actual mortality rate in nursing homes. And for the public, Governor Cuomo changed the methodology of counting nursing home fatalities to exclude out-of-facility deaths, to undercount those. I want to ask you, what period of time were you negotiating for your book deal?
Congresswoman, if there is a fact in what you said...
No, I'm asking you a question. I'm asking you a question. What dates did you negotiate for your book deal? That is the question before you today.
I'm answering a question that
you
asked.
The question that I asked...
My testimony says, during that time, did you have any discussions with the executive chamber regarding the need for guidance?
That's not the testimony I'm referring to.
Not that I recall.
Absolutely was the answer.
I recall.
Governor, absolutely. You're throwing your staff under the bus. You are culpable for this. My question to you is, when were you negotiating for your multi-million-dollar advance deal for your book as seniors were dying in nursing homes? That is the question in front of you.
You can't make up facts, Congresswoman.
You're the one making up facts. You're the one who undercounted nursing home deaths. You're the one who I want to ask right now. You apologize today, but there are families sitting here. I want you to turn around, look them in the eye, and apologize, which you have failed to do. Will you do it?
This is not about political theater. It's
no, this is about accountability.
Why did 1.2 million Americans die? Why did more Americans die than any country on the globe?
You're the former governor who's disgraced under oath.
lie to the people of the United States?
This executive order was under your name. It was counter to CDC and CMS.
Why did you let President Trump lie?
This is about those seniors, Governor. They deserve to hear from you in the eye that you apologize, that you were negotiating for a multi-million-dollar book deal. It is a disgrace. There is a reason why you were the former governor of New York State, and you will never hold elected office again. I yield back.
Thank you, Mr. Chairman. Governor Cuomo, I'd planned a series of questions, but after reading your opinion piece in the Sunday's Daily News and hearing your testimony here today, I'll use my time to correct the half-truths and lies that insult New Yorkers. You cite CMS data to claim New York had the 12th lowest death rate at the end of 2020. However, CMS began collecting data in mid-May, so the deaths when your deadly directive was in full force were not included. Your administration reported 6,000 deaths. The true toll was 11,400, nearly double. You assert your March 25th directive never mandated nursing homes to admit COVID-positive patients. This is false. Your directive very clearly says no resident shall be denied, and it prohibited COVID testing before admission. In your op-ed and again today, you claim that the directive mirrored CDC guidelines. This is also false. Both CMS and CDC use permissive language like can and should, not shall and must, and only if facilities could isolate and take precautions. Former CMS Administrator Seema Verma, former White House Dr. Deborah Birx, both testified that your actions violated those guidelines. CDC and CMS would never recommend prohibiting testing, yet your directive did, all while you were sending tests to the Hamptons for your family. And you also falsely claim this directive was the standard across the country, even trying to hide behind Minnesota Governor Tim Walz's directive when Minnesota's guidance actually included caveats, precautions. It didn't prevent nursing homes from testing patients like your directive did. You claimed that the March 25th directive was to protect hospital capacity, but you had the U.S. Navy Comfort Ship and the Javits Center deployed and it was remain underutilized. You said that nursing homes could still have denied entry to those they could not safely care for under existing law, but you suspended that very regulation in a March 7th, 2020 executive order stripping nursing homes of that ability to deny admission. And on top of all of that, you say New York didn't undercount nursing home deaths, yet your chief of staff directed that the deaths of nursing home residents outside the facility not be counted. And later, exactly 1 month after the New York Attorney General exposed that you underreported the nursing home deaths by 50%, your chief told Democrat lawmakers in New York that she admitted that the true toll was withheld to avoid attracting prosecutors. That, Governor Cuomo, is a cover-up. You've tried to blame everyone, including the CDC, the CMS, nursing home operators, nursing home staff, and unidentified low-level DOH staffer that supposedly sent out this directive. And of course, President Trump. But the buck stops with you. You testified that you don't know who signed off on this March 25th directive, and your DOH commissioner did not either, you say, despite both of your names being at the top of the letterhead. In the closed-door testimony, both you and your chief of staff told the committee it was some mid-level staffer at the Department of Health. But the commissioner and the deputy commissioner of the Department of Health said it was your executive chamber that approved it. You did not have a name on June 11th. Do you have one today? Who signed off on this directive? Was it you?
Let me try to...
Was it the Lieutenant Governor, Kathy Hochul? Was it your chief of staff, Melissa? No, it's a yes or no. I mean, was it you? Was it Kathy Hochul? Was it your chief of staff, Melissa DeRosa? Or maybe it was that communist spy. Maybe it was that communist Chinese spy, Linda Sun, who worked in your administration.
Well, maybe when
Let me just please finish, and I'll let you answer at the end. Because I find it hard to believe, Governor, that the governor of the state of New York, you're known to be a micromanager, right? Who did a briefing every day for 111 straight days. We find it hard to believe that you did not know that this directive with such consequences went out with your name at the top, and that you didn't get to the bottom, right? Don't you want to get to the bottom of who did issue this after all the media attention, the public scrutiny, the deaths that resulted? You've shown I'm sorry, but you've shown no empathy. You've shown no remorse. You show no responsibility for the actions of your administration, and that's just not leadership.
Yeah.
And I will say also that your lieutenant and successor, Governor Kathy Hochul, is just as determined to hide the truth from New Yorkers as you were. I mean, in her very first speech as governor, she promised transparency, including the release of documents related to nursing homes and the pandemic. Yet to this day, she has not fulfilled that promise, and I'm glad that we've issued a subpoena to get those documents. So who issued this executive order, this deadly directive? Okay. And why didn't you reverse the directive when you had alternative facilities like the Javits and South Beach Psychiatric Center on Staten Island?
Yeah. Congresswoman, quickly, the numbers I cited are published on the NIH website. It's a study that corrects for the numbers not received in May. Dr. Birx and Dr. Seema were not presented an honest account of what the New York law says. It's the Attorney General who said and interprets New York laws, and you were in the legislature, and you know that the state runs on the Attorney General's interpretation.
Governor, the time has expired.
Let me answer again.
Sorry.
I now recognize. Yeah, maybe for the record, you can answer the question that she actually asked.
Mr. Cuomo, I'd like to remind you that you're under oath. You've said a lot today. In your opening statement, you attacked President Trump and his response. I'd also like to remind you of statements that you've said. On April 13th of 2020 on the Howard Stern Show, you said, and I quote, "Trump has delivered for New York." He has. And then you talked about Trump sending the ship, the comfort ship. Mind you that the comfort ship was sent to New York on March 30th of 2020. That was just a few days after you signed the directive to put COVID-19 patients into nursing homes on March 25th, which led to murdering people's parents, grandparents, and great-grandparents. Yes, murdering them. Today you said, and I'll quote you, you said that high deaths in nursing homes is a conspiracy theory. Would you like to turn to the people here in this room today whose mothers died and their fathers died in these nursing homes and call them conspiracy theorists? Do you have the audacity to do that, Mr. Cuomo?
I never said that, Congresswoman.
You said that today. You're under oath.
I never said
There's video of all of your words today. You can be fact-checked. We'll do that when this is over.
Yeah.
You also blamed staff for spreading COVID in nursing homes, not COVID patients. You blamed the staff. But yet on March 25th, I didn't ask you a question. I'm talking to you. On March 25th, you signed a directive to put COVID-19 patients into nursing homes. On March 30th, President Trump sent the comfort ship, and you did not put COVID patients in the comfort ship. You didn't send them to the Javits Medical Center that President Trump had built, which was a field hospital. You didn't send them there. You put them in nursing homes, which is murder.
That's not.
No, that's murdering people. I'm saying that right now, and I'm also saying what a lot of people believe what your actions did. Let's also talk about some other things that you've done. Mr. Cuomo, let's talk about a tweet that you made because there's an indictment out on a woman named Linda Sun. Linda Sun, and I'll read this indictment. It says on April 4th, politician number one publicly thanked PRC official number one, both in public remarks and in a post on Twitter, that's this right here, for helping arrange the donation which was scheduled to arrive at JFK Airport in Queens, New York that day. So, Mr. Cuomo, you were thanking China, the PRC, while you had a woman named Linda Sun working for you, who has now been identified as a Chinese spy. Now, today you have come before the American people in our committee. You have insulted many people, including people in this room and people watching this hearing who lost their loved ones because of your March 25th directive. And at the same time, You were thanking the Chinese government while you had a Chinese spy working for you. So, Mr. Cuomo, I've read a lot about you, including the fact that 13 women that work for you accused you of sexually inappropriate behavior, which, thanks to the Democrat DOJ, helped you out of that. But I'd like to say this, and I'll ask you, are you either the dumbest tool of the Chinese government, or did you know for a fact that you were being used by the Chinese spy that was working for you?
I've read a lot about you too, Congresswoman. I think this is a very serious matter.
It is serious, that's right.
She was a junior member in my team. I wouldn't recognize her if she was in this room today. But I think it is a serious matter. I don't think this was just in New York. I think there is an infiltration of Chinese, maybe Russian operatives.
The Democrat Party's definitely had a problem with Chinese spies. Yes, you're right. And I want to remind you, you're under oath.
Yeah. And I think it's a serious issue, and I think the federal government and the state government should work together on it. The state government doesn't really have the ability to do the international reconnaissance, but the federal government does, and I think they should work together to make sure they're doing the best they can to do the vetting.
Mr. Chairman, I'd like to enter the indictment for the record.
So ordered.